Welcome to the Deep Dive, the place where we turn complex clinical concepts into clear, usable knowledge. If you're prepping for clinicals, studying psych nursing, or maybe even about to lead a group yourself, this deep dive is definitely your roadmap. We are going deep today into well, the powerful mechanics of therapeutic groups, and we'll kick off with a thought that really defines this whole field. It's a quote from Harry Stack Sullivan. He said, "It takes people to make people sick, and it takes people to make people well again." So that's our mission today, really. How does a bunch of individuals actually become a force for healing? Scientifically, psychologically, how does that work?
It's a great question because we're really peeling back the layers here, looking at the structure underneath. We're basically synthesizing the key ideas about therapeutic groups in psych mental health nursing. So a group, simply put, is just, interconnected people with some shared goal. But a therapeutic group, that's different. It's specifically set up, engineered almost, to foster personal growth, psychological development.
And the practical side is just huge, right? You can reach way more patients efficiently. Plus, it gives people this safe sort of lab environment to try out new ways of communicating new behaviors.
Exactly. And they learn from each other, too, sharing insights. Peer knowledge is powerful. But, we also have to be real about the downsides the sources mention. It's not for everyone. Privacy, for instance, is tougher. And just one person acting out, one disruptive member, can really stall things for everybody else.
Definitely a balancing act. So, okay, let's get into the why it works, the cure. Our goal here is to pull together the essentials, those hidden healing factors, how groups evolve over time, and yet the nitty-gritty of handling challenges.
Right, so you can't really talk about how groups heal without bringing up Irvin D. Yalom. He's the existential psychiatrist who really formalized this idea of therapeutic factors. These are like the active ingredients, the specific ways the group experience helps people get better. Yeah, Yalom's factors are fundamental. They basically tell us how to set up a group to maximize healing. Let's start with universality. This one's huge. It's that moment of realizing, oh, I'm not the only one. You're not alone with these thoughts, these feelings, these problems. Imagine like a group for anxiety. Someone might feel totally isolated by their specific fear, maybe agoraphobia, but then three other people share really similar struggles. Suddenly that feeling of being uniquely broken, it just doesn't.
Normalizes it.
Exactly. It cuts through that isolating shame.
That immediate shame reduction must be a massive boost. And I always think about altruism. That's another key one. This idea that members feel better not just by getting help, but by giving it. By supporting others, they feel useful, needed.
It builds self-esteem.
But here's a question I have. Is there a risk there? Could someone get stuck being the helper, the encourager role, like focusing so much on others that they avoid their own stuff?
That's a really critical point, and that's exactly why the leader has to manage the process, not just the conversation topic. Initially, that altruism boost is really healthy. It shifts focus from debilitating self-pity to something constructive. But yeah, if it becomes a pattern, like a way to constantly avoid their own issues, the leader needs to step in. Gently, of course.
Moderation is great.
Right. Feel needed, yes, but don't become the perpetual rescuer. Another big one is instillation of hope. This is like optimism spreading through the group. A new member hears someone else, someone who was maybe deeply depressed 6 months ago, talk about their progress, their recovery.
Like testimonials almost.
Kind of, yeah. That peer testimonial generates real belief that change is possible, often more powerfully than if the leader just says it.
Okay, and then there's the really fascinating one. Corrective recapitulation of the primary family group. Sounds complex.
It does sound a bit academic, but the concept is straightforward. The group becomes this kind of mini lab.
For family stuff.
Exactly. People unconsciously start replaying old patterns, old scripts from their childhood, with other members or the leader. So if you had a really critical parent, you might find yourself constantly seeking approval from the leader, or maybe getting defensive with anyone who seems authoritative in the group. The group gives you a chance to see that pattern happening now, in a safe space, get feedback, and actually correct it. Learn healthier ways to relate.
Wow, okay. So you get a do-over almost.
In a way, yeah. A chance to build healthier internal models.
And holding all this together is group cohesiveness. That sounds vital.
It absolutely is. Yalom stresses this. It's the connection members feel to each other, to the leader, to the group as a whole. Think of it as the foundation. Without that sense of trust, that non-judgmental acceptance, nobody's going to take risks. Nobody will share difficult things or try out scary new behaviors.
So that feeling of belonging has to come first.
It's the essential precondition for change. Research shows it strongly predicts positive outcomes. Okay, so we've got the why, Yalom's factors. Now let's look at the how, the actual mechanics of running a group. As a leader, the first big thing you have to grasp is the difference between group content and group process.
Content and process, okay.
Content is basically what people are talking about, the topic, the story is shared. If you had a transcript, that would be the content. Process. Well, process is kind of everything else.
The nonverbal stuff.
That's a big part of it, yeah. Body language, tone of voice, who interrupts, who avoids eye contact, where people sit. But it's also the underlying dynamics. The unspoken hostility, the alliances forming, the support being offered or withheld.
So like if someone talks for 10 minutes about a parking ticket, the content is the ticket.
Right.
But the process might be that they're totally avoiding the real reason they came to group today, maybe some deeper issue.
Perfect example. And managing that process, understanding those undercurrents, that's really the art of effective group leadership, not just reacting to the words.
Got it. And that process, that interaction, creates group norms, right? The unwritten rules.
Exactly. Expectations for how to behave. Like, it becomes understood you don't judge someone who's crying. Often unspoken, but powerful.
And leaders also look for group themes.
Yeah, those recurring ideas or feelings that keep popping up across different members or different sessions. Maybe themes of loss or betrayal or hope. Now, groups aren't static. They evolve through predictable phases. There are usually 4 key ones, and the leader's job changes in each. It starts way before the first meeting with the planning phase. This is all the background work.
Setting it all up.
Meticulous setup, defining objectives, deciding who should be in the group, like should be homogeneous, say everyone with bipolar disorder, or heterogeneous, a mix of issues. Open group where people come and go, or closed where membership is fixed.
And even the room matters.
Hugely. Seating in a circle promotes equality, encourages interaction, rows feel more like a lecture, room size, comfort, privacy, all part of planning.
Okay, then the group actually starts. That's the orientation phase, or forming.
Right, the forming stage. Here, the leader has to be really active, build trust right away, set clear ground rules, get people introducing themselves, maybe finding common ground.
And this is where that huge modern challenge comes in confidentiality.
Oh, absolutely. The sources really highlight this. Phones, social media. It's a minefield. The nurse leader must be upfront. Explain that while they are bound by professional ethics to maintain confidentiality.
They can't promise other members will.
Exactly. They cannot guarantee it because lay members don't have that same ethical code. You have to state that risk clearly. It's tough because it can impact trust, but it's ethically essential.
Transparency is key there. Okay, so after orientation,
We move into the working phase. This is usually the longest phase. This is where the real therapeutic heavy lifting happens. The leader's role shifts to facilitating communication, helping resolve conflicts that inevitably arise. And this is where you see Tuckman's classic stages play out. First, storming disagreements, maybe power struggles, testing the leader.
the rocky part.
Yeah. Then norming things settle down, cooperation starts, roles become clearer. And finally, performing the group is really focused, working effectively towards its goals.
It all wraps up with the termination phase.
Right, saying goodbye. The leader guides the group to summarize what they've achieved, reflect on insights gained, maybe set some future goals.
Seems like that could bring up a lot of feelings, too.
Definitely. Loss, sadness, sometimes even anger about the group ending. It's really important for the leader to bring those feelings out into the open and process them. Don't just let it fizzle out.
Okay, let's zoom in on the individuals within the group now.
Yeah.
People tend to fall into certain patterns of behavior, right?
Yeah.
It's that framework from Bennett and Sheets about functional roles.
Yeah, it's a classic and really useful way to observe what's happening. They identified 3 main categories of roles.
First are the task roles. These sound pretty straightforward.
They are. These roles are all about getting the job done, focusing on the group's main purpose. So you have the information giver, the person who clarifies things, the orienter who keeps track of progress. They move the agenda forward.
The engine of the group, you called it earlier.
Exactly. Then you have maintenance roles.
The social glue.
Perfect analogy. These roles focus on keeping the group together, making sure people feel connected and supported. Think of the harmonizer who smooths over disagreements, or the encourager who makes sure quiet members get a chance to speak, offers praise. These roles build cohesiveness.
Essential for that safe environment we talked about.
Absolutely. But then there's the third category, individual roles.
These sound less helpful.
Generally, yes. These roles aren't focused on the group's task or its well-being. They're driven by personal needs and agendas, and they usually hinder progress.
Like who? What are examples?
Well, there's a blocker, always negative, resists everything. The aggressor attacks others or their ideas. The recognition seeker constantly tries to be the center of attention, boasts.
You see these in meetings all the time, not just therapy groups.
Oh, absolutely. This framework applies everywhere. The key for a group leader is spotting these individual roles quickly, because if you don't manage them, those personal agendas can really sabotage the group's shared purpose. Task roles drive, maintenance roles connect, individual roles create friction.
Makes sense. And the leader's own style influences how all this plays out, right? There are different leadership approaches.
Definitely. The three basic styles are autocratic, democratic, and laissez-faire. And a good leader often blends them or chooses based on the group's specific needs. The autocratic leader keeps tight control, makes decisions, directs things, doesn't encourage a lot of back and forth.
When would that be useful?
Maybe for a very short, time-limited meeting with a really fixed agenda, like a quick community meeting on a psychiatric unit to announce the day's schedule. Efficiency over interaction.
Okay. Then the opposite.
Is the democratic leader. This style supports lots of interaction, encourages members to solve problems together, shares decision-making. This is generally the preferred style for most psychotherapy groups as it empowers members.
And the third one, laissez-faire. Sounds very hands-off.
It is. Minimal control. The leader lets the group figure out its own direction.
Does that work?
It can, but usually only in specific contexts. Maybe a creative group like art therapy or a gardening group, where the goal is more about unstructured expression or social interaction than specific therapeutic change. For most therapeutic groups, it's often too passive.
Got it. And there's also a distinction based on the nurse's qualifications, isn't there? Who leads what type of group?
Yes, that's important. Registered nurses, RNs, are typically prepared to lead things like educational groups, medication management, for example. Also task groups, like planning an outing, and support groups, perhaps for stress management or coping with a diagnosis like diabetes.
So focused on skills, information, support.
Right. But true group therapy, the kind that really delves into deeper psychological issues, unconscious conflicts, personality patterns, that requires advanced training. That's generally led by advanced practice registered nurses, APRNs, like clinical nurse specialists or nurse practitioners or other licensed therapists with specific group therapy expertise.
Okay, so even with the best planning, the right leadership style, good cohesion, problems are going to pop up, challenging behaviors.
Inevitable in any group. Leaders need tools, specific strategies based on evidence to handle those moments effectively.
Let's talk about some common ones. What about the monopolizing member, the person who just talks and talks?
The monopolizer.
Yeah.
They can really drain the group's energy and prevent others from participating. There's sort of a hierarchy of interventions. You might start subtly, address the whole group, maybe say something like, let's make sure everyone has a chance to share today. A general reminder.
Kind of nudge the group norm.
Exactly. If that doesn't work, the next step is usually speaking to the member privately outside the group session. You could explore why they're talking so much. Sometimes it's anxiety, believe it or not. Nerves make them fill the silence. Frame it gently.
And if that still doesn't help?
Well, the most advanced and potentially riskiest, but also most therapeutic move is to bring it to the group. Carefully facilitate a discussion where the group members provide feedback to the monopolizer about the impact of their behavior.
Wow, that sounds intense. High stakes.
It is. You have to manage it carefully so it's constructive, not just an attack. But when it works, it's powerful, both for the individual and for the group's honesty.
Requires real skill from the leader. Okay, what about someone who's just disruptive or angry?
Yeah.
Maybe defiant?
First step, listen objectively. Try not to get defensive yourself. What's underneath the anger? Often, talking to them privately can help de-escalate and build a connection. Understand their perspective. If the anger or defiance is happening in the group, direct, empathic, matter-of-fact language is often best. Like you might say, you sound really angry right now. Or maybe, it seems like you're feeling frustrated that the group is trying to offer support. Acknowledge the feeling without judgment, but keep the focus therapeutic.
Okay. And then there's the opposite problem, the silent member. They're not causing trouble, so maybe it's tempting to just let them be.
It's tempting, but not usually the best approach. Their silence means they aren't getting feedback, and the group isn't getting their perspective. Plus, prolonged silence can actually breed mistrust. Other members might wonder what they're thinking if they're judging.
So how do you draw them out without putting them on the spot?
Several ways. You can intentionally create pauses, giving them more time to gather their thoughts. Or you might structure an exercise where everyone has to respond briefly to a specific question or prompt. That's sometimes called a forced response. It gives them a structured way in, lowers the barrier.
Makes participation mandatory, but in a low-pressure way.
Exactly. The goal isn't to force deep disclosure, but just to ensure they're engaged and part of the process.
And wrapping this all up, we need to circle back to ethics, specifically that confidentiality piece we touched on.
Yes, it's paramount. We said the nurse can't guarantee pure confidentiality, but the other crucial ethical piece for the leader is getting clinical supervision.
Why is supervision so important for group leaders?
Because these group dynamics are intense. Leaders inevitably experience transference. That's when a member unconsciously projects feelings from past relationships onto the leader. And leaders also experience countertransference, their own unconscious emotional reactions to group members.
Ah, so your own stuff gets triggered.
Absolutely.
Hmm.
And if you're not aware of it, those reactions can cloud your judgment, interfere with your ability to be objective and therapeutic. Regular supervision with a more experienced clinician is essential for processing those reactions, managing those dynamics, and staying focused on the group's needs, not your own. Hashtag outro.
Okay, that brings us near the end of this deep dive. That was a lot, but you should now have a really solid grasp on how therapeutic groups function and why they heal.
Yeah, I hope so. If you take away just a few things, remember that core difference between the surface content, what's being said, and the underlying process, the interactions, the dynamics. That's where the real work often lies. Remember Yalom's universality, that powerful feeling of I'm not alone. It's often the first step towards healing. And keep those three functional roles in mind.
Yep.
Task, getting it done, maintenance, keeping it together, and individual personal agendas. Recognizing them is key.
Definitely. So we've talked all about how members take on these task, maintenance, or individual roles inside therapeutic groups. Now here's something to think about this week. Look at your own life, maybe your study group, your team at work, even your clinical cohort. We challenge you. Which of those three roles, task, maintenance, or individual, are you playing most often in those groups right now? And how do you think that impacts the group's overall success or dynamic?
It's a great reflection exercise. Because understanding these dynamics isn't just academic, right? It makes you a better communicator, a better collaborator, maybe even a better leader in pretty much any group setting you find yourself in.
Absolutely. Well, thank you so much for joining us on this deep dive into the fascinating world of therapeutic groups. We really hope this knowledge helps you in your studies and your practice.